Some people may be surprised to find that taking small doses of medical cannabis can have a completely different experience from a therapeutic perspective compared to when people take larger doses of THC. For many people, this is a better option. So let's talk about it. Hi, everybody. I'm Dr. David, a board certified pediatrician and medical cannabis expert in Tampa, Florida. Today, we're going to be talking about microdosing. This is when a person takes a rather small dose of a medication, in this case, THC, as a way of getting therapeutic benefits that may not be happening at a larger dose. And another aspect of microdosing is that a person is taking it more often at those lower doses. Now, you may have also heard about microdosing when it comes to some of the therapeutic psychedelics that are now being used, especially out west, which is a similar concept, taking a very small dose in order to get a different type of effect. Now, there are some advantages to microdosing, but compared to when a person's taking a regular dose, of course, when a person takes a regular or larger dose of THC, one of the things that will most likely happen is a person will have a euphoric, intoxicating, high type of feeling. And of course, there are people who very much enjoy that, who find it's actually beneficial for them for multiple reasons. But a lot of people also find that it can impact their function, their ability to focus, their ability to attend, their ability to operate a car, all types of things. And that's why, of course, we recommend that that can really impact a person's function, and why we say don't operate heavy machinery, cars, etc., when a person is using THC to the point where they're getting the euphoric effect. Now, also, for some people, when they take THC at higher doses, it can bring anxiety. It can bring paranoia. It can bring panic. And usually at lower doses, that doesn't happen. Now, also, when a person is microdosing, as I said, they really shouldn't get high at all. If they are, then it's probably not a true microdose. Now, also, when a person is using those low doses, they often are finding much better attention, much better focus. And I have seen patients who have even been able to come off of their ADD types of medications because they're using microdoses of cannabis. Now, some people will say they get it from larger doses too, but we're talking specifically about microdosing, of course. Now, and another advantage of microdosing is that it's a lot less money than when a person is taking a very large number of milligrams at a given time. And obviously, if a person is taking 1 milligram every hour for 10 hours, that's obviously 10 milligrams, where many people, when they're using higher doses, they may be taking 10, 20, 30 milligrams 2, 3, 4 times a day. So that's a very big difference as well. And of course, cost would be impacted as well based on how much a person is taking, because per milligram is how it's usually costed out, so that you know that. Now, in terms of how should a person microdose, and for medical cannabis, I just want to first off by saying this as a disclaimer. This is not specific medical advice for you, okay? These are general recommendations, things that I would commonly mention in a public lecture that I was going to be giving, but everybody is different. Different types of strains, different terpene profiles can make a difference for somebody as well. But of course, different diagnoses, different people have different sensitivities, etc. So again, the information I'm about to present right now is not the right thing necessary for you or your loved one, but just general guidelines, if you will. Okay. Now, also, if you're having any concerns, consult with your doctor. Of course, I can offer educational consultations for people who are not in the state of Florida or who are being certified by somebody else, and including helping them choose the type of product as well as the type of strain or terpene profile to be most effective for them. So that's something we're working with the provider who knows what they're talking about, or an educator if you're not actually serving as a patient of mine, how we can get things much more helpfully and hopefully accomplished the way we need it to. Now, in terms of when figuring out, let's first talk about tinctures. Tinctures are drops, okay? And usually it's one of the easiest ways to get a small dose, but you have to figure out how much that is first. So the first thing you have to know is how many drops is in your dropper full. Okay, or if it's even up to 1 milliliter, count it out. Pick the stem up and count drop to see how many is in there, so you know what a typical number of drops that is in 1 milliliter. Okay, that's most of the time there's a marking for 1 ml on the actual glass stem or plastic stem itself. Then, of course, the label will say how many milligrams there is per, not necessarily milliliter, but per bottle. So, of course, if you have a 600 milligram bottle and it's a 30 milliliter bottle of, in terms of how much liquid, that's going to be 20 milligrams per ml. And then you can count the doses out, and then you can figure out what that fraction is to get you to 1 or 2 milligrams, a very, very small dose, which is what we're talking about for microdosing. Now, I recommend in general for everybody, because low and slow is the key here. So starting with 1 milligram is really the best way of going. Okay. And I would recommend starting off every hour just to kind of see what the effective. Now, a person may find every 2 hours works just as well, but I think to start off with doing it on an hourly basis will give you a more understanding of like what this is going to be able to do. But after 3 days, I always recommend waiting 3 days before upping a dose, because maybe you had a good day, maybe you had a bad day, but in 3 days you should have a good idea as to what that particular dose does for a particular type of symptom, and then you can go up from there. Now, also, when it comes to doing a tincture, if you're able, and again, it's much easier when you're using a small dose to put 1 or 2 drops, to hold it under the tongue, to maybe put it here, what we call it, in the buccal area, in order to, and letting it absorb there. It will absorb faster, and it will go straight into the body in a quicker way, and also keep the THC as 9-delta THC. I know I've made other videos about the conversion in the liver to 11-hydroxy THC. Go check out the videos there. But, if you want to keep it as 9-delta THC, you don't want to swallow it. You want to keep it under your tongue or in the oral cavity, which, again, if you have a large amount that you're putting in there, it's going to go down. It's going to be swallowed. So now another way that people commonly do it is with gummies. But with gummies, you have to, again, know how many milligrams there is per gummy. If you have a 20 milligram or a 50 milligram gummy, you can't possibly cut that down to 1 milligram. But if you have a 5 or 10 milligram, then it's a little easier. Because, again, like a 10 milligram gummy could be cut into quarters, and then eighths, that'll make it about 1.25 milligrams per dose. You can also, if it's a 5 milligram, obviously cutting into quarters would be that same amount as well. And it's also something you can kind of keep as under your tongue, or it pocket into your cheek and let it get absorbed there. A person can chew it a few times just to open up the surface area. But when they do that, you still want to try to keep it in the mouth for as long as you possibly can. And then, of course, you may do it every hour, 2 hours, kind of see how it goes. And again, kind of increasing, very similar to what we were talking about when we were talking about tinctures. Now, this can also be done through inhalation. Now, of course, a lot of people, when they will inhale cannabis, whether they are smoking a joint or whatever, they'll usually take a lot. And of course, now that we have these higher potency flower products where, back in the day, 10%, 5%, 15% tops, but now you're seeing 20 to 30%, much more potent, meaning one inhalation will bring a much larger milligram dose. And of course, when a person, if they're using a vaporizer pen, if a person's using a 40% concentrate versus a 90% concentrate or more, of course, one inhalation could bring a lot more than if you're using something that's a smaller percentage of THC that's within that product. Now, also, one of the things that people can do, as opposed to, now there's nothing in here, this is just a blank, but a lot of people, as opposed to taking a long, and like a lot of times at the dispensaries, they will talk about using like a 3-second inhalation. That may be too much. Maybe just a 1-second inhalation, and then you take just regular air in. Or what some people do, so you can see here, this is an example, and you can see how this is kind of like a flat end around on one side. And so most people, since it kind of fits the lips, they'll kind of like suck it all in. But if you take it in with some air as well, or in a case like this, it dilutes it, and it gives a much lower dose of milligrams per inhalation. Now, again, so taking one inhalation every hour, that would be a microdose. If a few days later you don't notice any difference, you can take 2 inhalations, or you can take a longer inhalation, or take not as much air in with it. But all of those things is just one inhalation to start off with if you're wanting to microdose. Now, yet another way that people can do it, and I don't know if they have it everywhere around the country, but I know here in Florida, there's a couple of dispensaries that have patches. The advantage of a patch is it's a small amount being released consistently. So if it's a 10 milligram per 10-hour patch, it's 1 milligram per hour. But the advantage over all of those other forms is when you do a patch and it's consistently going in, it's happening like this. As opposed to any of those other doses, it's going to be more of an open down like this. And of course, if a person is taking it regular dose 2-3 times a day, it could be having this type of level in the blood. So the patch will give the most consistent small steady state across the course of the day. Also, there are some patches that if it's within the material, they can be cut. Some patches that's more of like a very thin, like cellophane type of pouch. If you cut that, then it'll spill out all over the place. So, but you can look at that. But that's one of the things people could do even for smaller doses is to cut the patches into, if it's a 20 milligram, cut it in half to make 10 milligrams. You can cut it into a quarter to make 5 milligrams, etc. So, if it's something that you're interested, if you're not getting the therapeutic effect from higher doses of THC, or if your stated goal is that you don't want to be getting high, you need to be functional. This isn't, that's not your goal there, but you needed to do it. This can be really, really attractive, and that's how you give it a try. All right, so maybe you learned something now. Of course, if you like what you hear, please subscribe to this channel. And we do, of course, offer to our Patreon subscribers lots of information there, including my primary care protocols, lots of other things that we don't share with the public that I do share with my patients. Have a great day.